Well, the pandemic has really been a challenge for patients with leukemia. We know that the leukemia patients are many times immunosuppressed, particularly the patients with acute leukemias, and those patients would have a significantly higher risk, not only of getting the infection, but more important, of having a serious infection that requires mechanical ventilation and could even have a fatal outcome. So what we had to do was adapt some of our care for the patients. The chronic patients that are stable, what we have done is keep them away from our healthcare facilities, keep them at home, be exposed as little as possible to any outside world, respect the isolation, a lot of hand wash, etc. And we can do all these elective periodic monitoring and assessments by telehealth or delay the appointments. The acute leukemia patients, they did have to if it was required that they had active disease, there was no choice, and you had to give them the treatment at the time when they need it. But we had to take extra precautions to minimize the infection. For example, our ward for the acute leukemia patients was completely separate from any area where any patient with infection would be hospitalized. We exaggerated our precautions, isolation precautions, so that fewer people would go into the room, even though they were all masked and gloved and well protected. That all the minimum number of people would go into the room. All the patients were checked for infection as soon as they came into the hospital to see if we were dealing with an asymptomatic patient that would require particular attention. So we had to adapt a lot of what we did. And fortunately, with those precautions, our institution did well, and our patients did not have major complications with that. But we do know that the serious complications and mortality rate in patients with hematologic malignancies was significantly higher than in the general population, unfortunately.